my name is Ricondo. My first reference is according to Shweta Dar, Patricia Furman, Moise Levy, Ankita Patel, and Fernando Scaglia's journal titled Tetrasomy 13q Mosaicism Associated with Phyloid Hypomelanosis and Precocious Puberty. In May 2009, it states tetrasomy is a form of aneuploidy with the presence of 4 copies instead of the normal 2 of a particular chromosome. My second reference is, according to the Chromosome 18 Registry and Research Society, date not found, article titled Mosaicism, web address www.chromosome18.org, stated, the term mosaic describes a situation in which different cells in the same individual have different numbers or arrangements of chromosomes. It is called this because, in a way, the cells of the body are similar to the tiles of a mosaic. Therefore, someone who has tetrasomy 13q mosaic, some of their cells have 4 copies of chromosome 13, while other cells have 2 copies of chromosome 13. My third reference is a personal interview with Sharon Florence, February 20th, 2017, mother of Elle Florence, who was diagnosed with tetrasomy 13q mosaic. I am her caregiver, so I had an interview with Sharon. I found out that due to her disorder, Elle was born with 6 fingers on her right hand. She also had a salmon-colored patch on her forehead and the back of her neck. Her heels stick out a lot more than normal. Her sternum sticks out, creating a point at her chest. She cannot speak at all. She cannot say words. She can only create noises and scream, yet she understands everything we are telling her. We will ask her questions such as, and her parents will ask her questions such as, do you have to go to the bathroom? And she will answer with yes or no. And the way she does this is she clicks her mouth for yes, and if she does not want to or she does not need to, she will not say anything at all. She'll just ignore you and do whatever she's doing. Up until the age of 4 years old, Elle has had to be fed through a G tube, which she has in her stomach and still has. At the age of 5, Elle started having seizures, and she has had up to 20 seizures in one day. She was not supposed to be able to walk, but with physical therapy she can walk, but with the help of someone, which is me. I am her caregiver, so her mom hired me for this reason, to help her walk and so that she doesn't fall and she doesn't have a seizure and fall, just to keep an eye out on her. Elle's parents are the only parents to keep their child when finding out their baby has tetrasomy 13q before the baby was born. In other cases, the parents have terminated the baby after finding out that their baby is diagnosed with this disorder when the baby was still in the womb. In the rest of the cases, the parents did not find out until after the baby was born, sometimes even years after the baby was born. My fourth reference is, according to Haddad, Abora, Tosca, Guidesh, El Hermin, Duarte, Picon, Brissett, and Tashdjahan journal titled Tetrasomy 13q 31.1 quarter due to an introverted, duplicated, neocentric marker chromosome in a fetus with multiple malformations. In 2012, a 22-year-old Caucasian woman was referred to our prenatal diagnosis center at 12 weeks. When she had an ultrasound examination, they found cysts in the fetus's neck and intrauterine retardation. This was the first time they had found something going wrong with the healthy parents. At 14 to 17 weeks, they found out the fetus had enlarged kidneys, short long bones, and cerebellar hypoplasia. After genetic counseling, the pregnancy was terminated at 17 weeks. And lastly, my fifth reference is, according to RX List, date not found, clonazepam drug overview and uses for patients and caregivers from rxlist.com. RX List states, to help with seizures, the patient can take a pill called clonazepam 3 times daily. Clonazepam is used to prevent and control seizures and works by calming your brain and nerves. Thank you for listening.